But first, we begin our show today with one of the show sponsors, Beautologie, and our delightful guest, as always, joining us, Dr. Milan Shah. He is the Aesthetic Medical Director at Beautologie Cosmetic Surgery and Metaspa. Good morning, Dr. Shah. How are you?
Good morning, Lisa. Thank you so much for having me.
As
I'm doing great.
Always
Thank you.
great to see you. Thank you so much for coming by. Today, we're going to talk about a lot of things. We're fortunate to have you for two segments. So the first thing we're going to talk about today is a skincare line. And if the folks at Beautologie like the skincare line and sell the skincare line, then I want to hear all about it because obviously it must be good stuff.
Yeah, absolutely. So, medical grade skincare is a little bit different than the stuff you'd get at, say, the mall or
Sure.
over the counter. What we're trying to focus on is deeper layers of the skin. We're trying to go after, damage that's accumulated over the last, not just year, but the last 5 or 10 years, whether it be sun damage or acne scars that have accumulated, or what we see a lot of in the Central Valley is that melasma or that hormonal pigmentation. And it's something that's, accumulated again over many, many years. So we're working on deeper layers of the skin, and we're exfoliating that skin off and trying to bring out some healthy new skin in its place. Skin that's more youthful, that has that healthy new glow back.
So what types of products are we talking about? Because, we know from years of doing the same old things, I think sometimes the ladies like myself fall into ruts. Well, I used this when I was a teenager, so it should still be good.
Yeah.
But as we age, our skincare needs change.
Absolutely. So one of the prescriptions that we actually incorporate in the system, one of the biggest medical grade creams in the system is prescription Retin-A or tretinoin. And what it really is, it's a derivative of vitamin A. So it's actually a vitamin that we're delivering deep down into the skin. What Retin-A or vitamin A does, during our teenage years, dermatologists used to prescribe it for acne, and it does have a great utility in acne. But we're really not using it for acne. We're using it as a way to get rid of old skin again, and wake up some healthy new collagen. And Retin-A itself does so much. In fact, as far as stuff that's effective and that's been tried and true and studied, other than sunscreen, Retin-A is it. If you really want that one anti-aging cream, that's what Retin-A is. And so Retin-A is one of the main components of this system.
And how does it get delivered? We're talking deep in the dermis. Is it underneath it? We just
Yes.
use an exfoliator to get the dead skin off?
Absolutely. Great question. So, a few other parts of this system are ways to prep your skin. And there's a great cleanser that just kind of cleans out those clogged pores, those oil glands. We have a toner that pH balances the skin, so the other components work a lot better. There is an exfoliation regimen. There's a glycolic acid in here that helps to get rid of some of that dead skin that's on the surface of the skin. And then the Retin-A is actually, the way we've manufactured it, it has something called saponins that are mixed in, and that saponin is drawing that Retin-A a little bit deeper down into that dermal layer of skin. So with all of these things, yes, the Retin-A really hits its target.
Working together. We mentioned how our skin needs change as we age, but also I've heard for years, I never knew if this was actually true, but that our skin needs change through the seasons. Is that true as well?
Yeah, that is actually very true. Number one, especially again living in the Central Valley and just Southern California in general, our sun is brutal out here, and so we have to be extra diligent during those warmer months to not only protect our skin, but also kind of maybe undo some of that extra accumulated damage. And so using a little bit more vitamin C and also maybe a little bit more of sunscreen just in general during the summer months.
Year-round too,
right,
but
year-round,
especially in the summer.
it is so important. And then, coming into the winter months, the drier months, moisture is of course a big thing. And when it's dry out there, we feel dry, but our skin's also a little bit more cracked and chafed and dry. And so actually preparing for that ahead of time by doing a lot more exfoliation ahead of time, building up a more resilient dermal layer of skin is going to make sure our skin is more resilient during those winter months.
Now, how about the air pollution? Air pollution, big topic of conversation, especially in about the last week or so. Does that damage your skin as well? You hear things about free radicals and the outside elements. Is that also true? Something we need to worry
Absolutely. Unfortunately, yes. The environment does play a big a role in how well or how not so well our skin ages. And so, if we're in a very industrial area with a lot of pollutants in the air, yes, those free radicals are damaging the skin. They are breaking down our skin. I mean, up to the point where they could actually influence certain types of skin cancer as well. So, it's stuff that has to be taken very seriously. I mentioned vitamin C. Vitamin C in its purest form is an antioxidant. It's something that fights those free radicals off. And so, using a little bit of vitamin C, and it's something that we have as part of the Beautologie system, is doing just that. It's stopping the harmful effects of the environment, the pollutants in the skin on or aging our skin.
Boy, that's a lot to think about. We've got the air pollution, we've got the sun damage, we have the fact we're just getting a little older.
Yep.
And so who would these products specifically be good for? Is this something that a teenager could use, as well as someone seeing a few wrinkles for the first time around the eyes, as well as someone maybe seeing the advanced stages of aging?
Right. So, the system itself, it works for a multitude of different types of patients. However, we do kind of fine tune it depending on who's coming to us. You mentioned teenagers. If a teenager is just starting out with acne, and they have acne, they may have a little bit of acne scarring, we might tweak the system a little bit, where we're using a little bit more of alpha hydroxy acids, as we call them, a little bit of salicylic acid, or benzoyl peroxide to go after the acne. Plus, also use some of the components in this system, the bleaching cream and the Retin-A, to get rid of some of that acne scarring. If it's an older person, maybe in their 60s or 70s, let's go to the opposite spectrum, that wants to maybe undo a lot of that sun damage that they've accumulated in their youth, then we're hitting it a little bit harder with the Retin-A's, also using bleaching creams to get rid of a lot of that pigmented damage, maybe a little bit of vitamin C. So we do tweak it a little bit, but this system is just a great all-around system for anybody that really just wants to get that nice, new, healthy glow back to their skin.
How about people who smoke? I've actually had professionals in your line of work say that if they have a patient who's a smoker, that this stuff isn't going to help them. Is that true? Is the smoking that damaging to our skin?
So yeah, tobacco smoke with the nicotine is definitely affecting the blood flow to the surface of the skin, and so our the typical patient that's smoked for several years is going to have a lot more damage on their surface of their skin. It's never late to start, though. I mean, we can still go after that skin. Yeah. You do want to protect your investment. If you are going to be investing in, say, a system, or maybe even something more aggressive like a laser, or even surgery for that matter, I mean, we're going to encourage the patients, just like their primary care is encouraging them not to smoke for other reasons. Right. Protect your investment. Your skin is one of the biggest organs on your body, and nicotine definitely affects it. So if you're going to go after this damage, quit smoking. Besides
tobacco smoke, you hear the effects, especially it seems like when we get closer to the holidays. I read a lot of magazines, and they're saying, if you drink too much alcohol, it can really affect your skin. Just the dehydration, or is there something else we need to watch out for?
Yeah, I mean, as you know, alcohol, of course, does dehydrate you, and
sucks all the water out of you.
Yeah, that's a big thing. But alcohol itself can actually affect hormone levels as well, and those hormone levels, stress hormones, even estrogen, progesterone levels, being out of whack can have a direct negative effect on the skin. And so that, and of course, not to mention other things, other damage it can do. It just, in moderation, it's fine. A glass of wine, or cocktail on occasion is totally fine. But it's those heavy, binge drinkers where yes, absolutely. Again, the skin being the biggest organ gets affected just like every other organ in the body.
And sometimes you hear about, can you tell I'm fascinated by this? I actually have a little bit of knowledge about this just watching skincare trends, if you will, change over the last 20 years or so. But people say if you eat salmon, it's good for your skin. Is that true? I mean, we know what we should keep out of our bodies, but what about what we should be feeding our bodies? And is there anything that will help promote healthy skincare we can add to our diets?
Yeah, absolutely. You want to have a diet rich in antioxidants. You want to have a diet rich in leafy vegetables.
'Cause I like fish, but not for every meal. So I wanted some other ideas.
Right. Yeah. I mean, you don't have to have a fish every every night, but the whole point of the fish oils, the omega-3s and the omega-6s that you're deriving, along with other antioxidants, are helping to prevent against that oxidative stress on the skin.
Right.
And so, absolutely, that's a fish-based diet is great, but I think just an overall nutritious diet, high in leafy foods, leafy vegetables, together with your omega-3s and 6s is great.
Well, I'll tell you what, we have a lot more to talk about with you. We sure appreciate you sticking around. When we come back, we'll have more with our visit with Dr. Shah from Beautologie. But first, remember, you are watching Live Well, only on Bakersfield.com. And so far this morning, we've been visiting with Dr. Shah from our program sponsor, Beautologie Cosmetic Surgery and Medi-Spa, and he has agreed to stick around this morning. I have a lot of questions about this topic for sure, and he's also going to talk about the array of services that they offer to keep you looking your best because it's the holiday season. Ready or not, it's already here. So earlier today, we talked to you about the skincare line that you do carry. It's called the Prescription Skincare line. And now we're going to talk about the treatments that you offer at your Medi Spa that can freshen people up for the holidays, because we all know it's stressful. And you always hear people say, take a little time for yourself. You don't want to show up at the holiday party looking like, you've been up for 3 weeks and going hard, because pretty much everybody does this time of year. So let's start with the advantages of a chemical peel. I've heard about these, never actually had one. So let's start with just the basics. First of all, what are they? They sound kind of scary when you use the term chemical peel.
Right. So, chemical peels, actually, they've been around for many, many years. The first chemical peels you could trace back to the ancient Egyptians. And
Really?
basically, it's an acid, and usually it's kind of a fruit-based acid. And these acids are used to take off a few layers of skin. And usually, when we're taking off layers of skin, we're getting rid of surface damage. We're getting rid of sunspots. We're getting rid of some of the pores that have really kind of opened up on the surface of the skin. We're getting rid of maybe a few fine lines and wrinkles. Chemical peels come in varying degrees of how deep we actually go. We have our gentle esthetician grade peels, our light glycolic and salicylic acid peels that really are very, very comfortable. They're a quick 30-minute procedure where a client would come in and we apply this medication to the surface of the skin. It feels a little tingly, maybe a little bit of a burn, but it quickly dissipates. Usually a couple days later, you see a little light peeling, kind of like the peeling you'd get if you're out in the sun all day and you get a little sunburn. And then you're right back to your regular routine. And it just kind of gives you, a freshened up look. Now, say patients do want to get a little bit more aggressive, then we have our medium to deep grade peels. And one of the peels we do is called the trichloroacidic acid peel, or blue peel. And what this peel does is it exfoliates pretty much the entire top layer of skin, the entire epidermal layer of skin.
Wow.
And along with our skincare line, it can go a little bit deeper down. It's kind of like the icing on the cake. In our clients that have melasma, that pregnancy mask, or
Wow, yeah, that wasn't a whole lot of fun.
Right,
Yeah.
and so-
I was like, what's that? That's new.
Yeah.
But luckily, it fades. Sometimes I think
fades.
it can fade.
Yeah, it sure can
Sometimes
fade.
it doesn't.
Right, and sometimes it sticks with this because
Yeah.
it's so deep down. And so adding that deep chemical peel to the mix is going to go after a lot of that as well. So and something like that, the downtime is a little bit more, upwards of a week, where you do have a lot of peeling, and there's no discomfort during that week. But you do have to stay at home because it is a lot of peeling.
Right. If you just have that the first one we talked about, the real
The glycolic peel, the light one.
right. Can you wear makeup like the next day, or?
Yeah, absolutely. Usually, in about 24 to 48 hours, you're okay to put makeup on. Go about your regular routine, and there's no real downtime. Even that day, you don't have to, stay at home, but you just have to be a little bit extra mindful of the sun.
Very good. So how long till people see results from, say, the first one we talked about versus the second?
The glycolic peel is something that patients will usually come in maybe a couple times a year just to kind of keep up, maintain those results. If we do something as aggressive as that deep blue peel, usually that's not something we do more than once a year.
But it can take care of wrinkles, you mentioned. I had no idea. That's fascinating. So those are the different types that you offer. And you also have, and this is another reason I love having you here. Every time you guys come in, we talk about the latest medical technology. You guys are always on the cutting edge. So today we want to talk about, you have several different things. This one is a resurfacing laser. It's the CO2.
The CO2 resurfacing. So now, we're talking about a laser that goes a lot deeper down. And so if patients are wanting to maybe turn back the clock, not just a year or two, but maybe like 5 or 10 years, gals that have like heavier wrinkles, deep set wrinkles, or again, really deep pitted acne scar on the surface of the skin, they're wanting a one-time kind of end-all procedure. The CO2 laser is the way to go. It's something that does require a little bit more prep work, a little bit more downtime. It's ideal to do in the fall and winter months, just because you are a little extra sensitive to sunlight for a few weeks after the treatment. But again, very, very dramatic results with a procedure like that.
And that, again, the purpose of that is to take care of the scarring, maybe some deeper wrinkles.
Right, exactly.
Just
So
something else in the arsenal, right?
Right. The typical client would be a patient in their maybe 60 plus age range that have more heavier wrinkles for maybe, lying out in the sun a little bit too much much in their younger years, or just because of genetics, having those heavier set wrinkles, and they're really looking to tighten up that skin, that would be the ideal candidate. Or again, patients that have that really deep pitted acne scarring from years of acne.
You also have something there called the IPL laser, and I don't think we've talked about that before.
So the IPL is actually kind of our lunchtime procedure. IPL stands for intense pulse light, and what it is, it's a bright light that basically zaps any kind of pigment that's on the surface of the skin, whether it be, again, a brown spot or maybe a little blotchy red, or maybe a little tiny vein. It's going to see those little pigmented spots on the surface of the skin, and not just on the face. We actually use it for parts of the body. Here's a depiction of somebody that's actually had IPL treatments, IPL Levulan treatments, to go after some of that heavy blotchiness, and you can see, we're getting pretty good results.
Those
with
are
it.
quite dramatic.
Yeah. And again, not a lot of downtime. It's something where you come in, you're with us for about 30 minutes, you're a little flushed after the treatment, and shortly thereafter, you're okay to go back to your regular routine.
Wonderful. And then the Venus Freeze, and you brought that up here. We got this big piece of equipment up here in the studio, and we did a little resurfacing and on the neck area, but there's a lot of different things that you can do with that. I thought it was fantastic. It was a lot of fun when we had it come in.
Yeah, it's a great device, and it's one of our newer devices where with these new devices, our goal is minimal downtime, great results, and minimal discomfort, and that's the trend of all our lasers. The Venus Freeze goes after tightening. It goes after, when we get laxity in our skin just from aging, we're trying to bring that skin back to its original position. We're trying to firm it up, restore some of that lost elasticity. So it works to really tighten the skin, but then it also works to go after areas of stubborn fat. The same technology is used to shrink fat cells down, and so we could go after areas like love handles, or when there's a little bit of a kind of like that pooch in the belly area, we could shrink that down with a few short treatments, and again, very comfortably and with no downtime at all.
It didn't hurt at all when I had it done. When it shrinks those fat cells down, are those permanently gone, or do they come back eventually? Or if I go and have a great big lunch, do they pop right back? How does that work?
So, yeah, great question. So, with liposuction, which we do at Beautologie, the guys are actually sucking those fat cells out.
They just take them all the way. Okay.
Right. With this laser, we're going after the fat cells, and we're actually pushing out the triglyceride, which is a component of the fat cell. We're getting rid of a component of the fat cell, and thereby shrinking it down. Now, it is indefinite in as long as our patients kind of maintain a healthy lifestyle and nutrition routine. But if you go out there and you hit those fast food joints, those fat cells will re-expand.
Sure.
So in that way, it's not really permanent. But as long as you protect your investment, it can be indefinite.
I love that, protect your investment. I once had someone say, if you spend as much time working on yourself as you did working on your career, you would never have to worry about it. And I thought that made a whole lot of sense to me when they said that.
Yeah.
How about folks dealing, again, with acne scars? The Venus Freeze, does that, because we had talked about that for blotching and for the marks from aging or hormonal things. Does that also work for the acne scars?
So our newest technology laser that we have in our practice is called the Venus Viva. It's actually the same company that makes the Venus Freeze. And this is brand new cutting edge stuff. It's called fractionated radio frequencies, a type of energy that we're using. And like the Venus, we're using radio frequency, but with the Venus Viva, we're delivering the radio frequency much deeper down into the dermal layer of skin, the deeper layer of skin. And so now with this new Venus Viva, we're able to go after pitted acne scarring, but without all the downtime of that CO2 that we talked about. The Venus Viva is great. Our patients will spend about 30, 40 minutes with us. Wow. There's just a little bit of numbing we do prior to the procedure. Patients are a little flushed after the treatment. There could be a little bit of swelling as well, but again, within a day or two, you're back to your regular routine. It does take about 3, maybe 4 sessions, but we're really now able to go after the pitted acne scars. And the nice thing about this laser is before we were a little restricted in the skin types we could use a laser for. We could only do it on lighter skin. With the Venus Viva now we could go after even darker skin. We have a range of 1 through 6 of Caucasian to African American color skin, and we could actually do all that entire range with the Venus Viva laser.
Are we talking about things like stretch marks, spider veins? Someone walks in and says, "Can you fix this and that and the other thing?" And you say, "Yeah."
Yeah, and so we try to cover the bases with our entire armamentum of lasers. We have about 11 different lasers we use in our practice, and the Venus Viva is actually actually something that's meant to firm up skin, go after acne scars, but we're actually trying it out on stretch marks, not just colored stretch marks on, but white stretch marks as well.
Right.
And we're seeing positive benefits with it. And so it's kind of like, stay tuned to things that may come out of this laser, but it's a wonderful laser. Here's a picture. This is actually our IPL laser being used on pigmented stretch marks, and this is a few treatments after. But now, even with white stretch marks, we could actually have some benefit with this new laser.
That is amazing. So this question I always like to ask you, what's next? I mean, every time I come in here, I say, what's next? There's always something coming that's just amazing.
Right, and so, I think, the Venus Viva we've had in our practice just for a couple months now. It is, I think, the next best thing in terms of how good it works, and and the scars have always been a big thing. Whether it be a scar from an accident early on, a scar from a surgical scar, or just acne, deep pitted acne scars. They've always been really tough and tough to go after in terms of how much downtime a patient has to endure, how much discomfort they have to endure. This I think is going to be the answer to all that. This new technology. It's also referred to as a sublative laser, a laser that kind of really targets deep down layers of skin, but without all that downtime. And so I think the Venus Viva, we're really excited to have it, not just in our office here in Bakersfield, but we actually have it in our Fresno office as well.
That's right, you sure do. And you also do a lot of work with tattoo removal, I know, and I know you guys are kept very busy with that as well. And if people are concerned, it seems like when you start talking, the girls get together, we'll start talking over a glass of wine about, well, what would you do? What would you do if you had the time or the money? What would you do? And it seems like it's becoming something more commonplace, and people are more maybe accepting of it. And what I hear, people are concerned about the pain. And all I can tell them is, remember that time you guys came in and gave me the Botox?
Right.
Didn't hurt at all. Right. And then we did the other thing, and there was no pain. But if someone goes in there and they're uncomfortable, you're going to do something to fix that or change
Absolutely.
it.
This
Right.
is this is not meant to be an excruciatingly painful
No.
procedure. We want it to be as pleasant as possible. And there's a lot of different things that can be done, and that is a very, very big concern. Of
Sure.
course, is the discomfort. And there's so many things, and all too often patients actually are very, very pleasantly surprised that it wasn't as bad as they thought it was going to be. For example, one of the most, I think, uncomfortable procedures that can be done is lip injections. Well, and that can be very painful if we're just, going right at it and starting to inject. But we do a lot of things beforehand. We use creams to topically numb the area. We use shots of lidocaine, kind of like a dentist
As I
does.
say, you guys just like a dentist.
Right.
Perfect.
And just making it more of a relaxing, soothing procedure. We use something called just verbal anesthesia. Just talking to our patients, really kind of sets their mind at ease, and they get through it just fine. Yeah.
Wow. Well, if people want more information about your products and your beautiful facilities, where can they find that?
Sure. They could go to our website. Our website actually has a lot of great information. It's www.beautologie.com, and Beautologie spelled BEAUTOLOGIE. Or they could call us at our office. The number is 327-3800, and they'll be transferred to one of our lovely appointment coordinators. They could start them off with some great information, but we really encourage our clients to come in for that consultation with myself or
Right.
one of our other associates at Beautologie, and the consultations are completely complimentary, and we'll kind of point them in the right direction.
Is it too late? So I just mentioned at the top of the segment, it's almost here. It's almost holiday season. There's still time to get appointments in to be fabulous?
Yeah, absolutely. In fact, we've expanded our staff just to kind of accommodate, just for, our growing
holidays
Bakersfield
hours.
population
Yes.
and our holiday hours as well. And so, no, it's not too late at all. There's a lot of great things we could do before, the holidays.
As always, Dr. Shah, thank you.
Thank you
Continued
so
success.
much.
I've really appreciated our time here together over the last year or so. We're going to take a quick timeout.